Hi, my name is Albin Vleck. I'm a fourth-year medical student at IU School of Medicine, and I'm going to talk with you about intraoperative potassium management. So this came up during my anesthesia rotation. We had a 23-year-old patient who was being worked up for a kidney transplant, found to have a mass on his right kidney, so he came in for a right nephrectomy. He has a history of end-stage renal disease, and his last round of dialysis was yesterday. The morning of surgery, we decided to check potassium, and it was at 6.2. So the first thing to be aware of is when you want to be looking for hyperkalemia. Though we do a general check of BMPs for most patients, there are some cases where you want to be particularly aware, particularly things like congestive heart failure, cirrhosis, burns, or even dependent on medications that they're taking. And then we also want to be aware of what we can change and what causes the problem. There is long-term dysregulation, and usually that occurs in the kidneys. However, there are some temporary shifts that we can make to stabilize a patient in hyperkalemia or to just temporarily put them into a normal kalemic range prior to doing more definitive management. So now I want to talk a little bit about some treatment algorithm. First thing that we wanted to check was an EKG. We wanted to see if there were any cardiac abnormalities associated with this that would guide our treatment and if we were even to continue surgery or delay it. We got an EKG and that didn't show any cardiac abnormalities. So with that, we didn't give him anything like calcium chloride, which stabilizes membranes. We also didn't give him sodium bicarb, which is usually given to take from an acidotic state to an alkalotic state. He has end-stage renal disease, and the efficacy of that is less known. We ended up giving him 10 units of insulin with D50 to prevent hypoglycemia. We checked his ABGs every 30 minutes, and during surgery, his potassium stayed around 4.2, and we made sure to schedule him for dialysis, definitive treatment for his hyperkalemia, later that day.